So we'll discuss about this disease. And down the memory lane, when I was in second MBBS, I had been to the regional transport office to take the license for my two-wheeler. I had mungfali which was boiled, and after that the soil which was stuck to the outer peel of the mungfali probably had the hepatitis A virus, and then I had hepatitis A. I was in the bed for 3 weeks. One good thing happened that one of my batchmates, who was a beautiful girl, she started visiting me every day to check whether I have jaundice, whether it is increasing, whether planters are upgoing, whether he is going in liver failure. But I was going in liver failure as well as heart failure, because whenever she used to touch me, I had a different sensation which you can imagine. And apart from, of course, planters were not upgoing, other things were upgoing. But then at that particular moment, I realized that hepatitis A is very important. Later on, she came into my life as my wife. Okay, so this particular topic has a close association with my liver as well as my heart. Okay, and that's why it is important. Okay, now remember that acute viral hepatitis is one of the most important and the leading cause of hepatitis A is the leading cause, and the age of infection is shifting. That is what we are going to see. And then the virus which is called as picorna virus. One of my Khadus examiners, he used to ask many things about hepatitis A. What is the type of hepatitis A virus? So that last RNA basically is, because it's an RNA virus, so it is a pico-RNA, picorna virus, okay? And it is destroyed by 3 Bs, boiling, bisleri and bleaching powder, remember that. And there is only one serotype of hepatitis A virus. All the hepatitis A vaccines, they protect against all the wild human hepatitis A virus. That means the strain in the vaccine could be anything, but the vaccine will protect, okay? And the humans are the only source of infection. You have never seen any dog or a cat or a ox or a lion getting hepatitis. They never get it, okay? Only human beings get it, okay? And let us discuss this inactivated hepatitis A vaccine over Nescafe with Pramod. So we will discuss it under the headings of need of the vaccine, efficacy, safety, cost effectiveness, affordability, feasibility, ethicality, and whether the vaccine is pre-qualified by WHO. Okay. Now, whether hepatitis A disease in India has evolved over time. Remember that as I told you, it's number 1 among the 4 acute viral hepatitis. And in a child who is under the age of 2 years, you know that majority of the children are asymptomatic, even they don't have rather icterus. So that is called anicteric hepatitis. One of the IT sector patients recently came. The child had dark colored urine. So I said, this is likely to be, hepatitis A because the urine is dark colored. Child is not eating well. He was a small child. And then of course, IT sector is not information technology. They are the inquisitive and the troublesome patients. Okay. They come with a Bermuda pant. They will put their laptop on the table and ask 100 questions. Finally pay only 100 rupees, 1 rupee, 1 question. So now these people, they ask many questions. So you should know that between 2 to 5 years, 50% of the children will not have jaundice, but older children and adults, more than 70% will have symptoms including jaundice. So remember, under the age of 2, anicteric hepatitis is the rule. And we need to worry about hepatitis A. You will ask me, then why you should worry? Because it is the first cause of fulminant hepatic failure. When we were students, our seniors used to tell us, don't worry, hepatitis A is not a very dangerous disease in children. But now the days have changed. And particularly if a child is about 10 years, then the disease becomes serious. And as we are going to listen from Mahesh about the cytokine storm, the immune response in hepatitis A is more aggressive as the age advances, okay? And that is why beyond the age of 10 years, the disease is more dangerous. Remember, there are 3 things: high endemicity, intermediate endemicity, and the low endemicity. What do you mean by that? That means in the beginning, before we had the culture of having distillery water, good hygiene, good sanitation, the incidence in children was very high. And that is why the immunity in children was high. And that is why, as these children, they grew, very few cases were there in the adults because they had antibodies. And once the infection means lifelong antibodies in the child, okay? And that's why there were few serious cases, because these children would grow up with seropositivity, antibodies against hepatitis A. That is why in adulthood, they won't get serious disease, okay? But then later on, the sanitation improved, hygiene improved, people started drinking good water, and that is why the incidence in children went down. And that is why the immunity in children was on the lower side. As children did not have the immunity, as they grew up, after 10, I told you the disease becomes serious, and that is why more cases were seen in the adults, and then more severe cases started coming up. Okay, so remember that hepatitis A immunity over a period reduced from 74% in 2009 to 44% in 2017. What does it mean? It means that children who were seropositive right from the beginning of life, they stopped becoming seropositive, and that is why the disease started manifesting at a later age. And I told you after 10, it started becoming dangerous. So there were many outbreaks, and between 2017 and 2021, 84 outbreaks were reported. Maximum were from Kerala, which is called as the God's own country. But along with God's own country, they drink country, but they drink good water. Okay, and that is why along with the good water, the hepatitis A doesn't go. And later on, these children there, they started getting hepatitis A, and that's why more epidemics in Kerala and good states of India. So, two important questions which that Khadu's examiner used to ask me. One, what is the relation between bilirubin and SGPT? So, whenever there is hepatitis, in the beginning, bilirubin starts rising. Later on, SGPT also along with bilirubin rises, but then when there is hepatocellular damage and the liver cells are totally going off, then bilirubin continues to rise, but SGPT starts dropping. So, rising bilirubin in the face of falling SGPT is a bad sign. And then prothrombin time is like a daily laborer. He gets 1,000 rupees every day, he finishes off on that day. Prothrombin time, you have to monitor it daily. Serum albumin, it is like a professor in Department of Pediatrics in the medical college. He gets fixed income on the first of every month. By the end of 30 days, he has finished the stock. So it's a chronicity. So albumin is indicative of a chronic liver disease. Remember that. And then I told you many things about the pre-vaccine era and the post-vaccine era. So what you should know is that hepatitis A infection in adolescents and adults is something which is to be worried about. And acute liver failure and acute on chronic liver failure cases, they do occur. And along with that, you know that adolescents, when they grow, they will have a lot of food from outside, and they are more vulnerable to get hepatitis A. And in this scenario of shifting endemicity and the recent outbreaks, what is the need of the hour? It is to have good food with hygienic measures, a good drinking water, safe drinking water, personal hygiene, and vaccination. So, this is only to revise what I said. Reduced childhood exposure to virus, which leads to increased susceptibility in the older children, and then increased risk of outbreaks in adults and the adulthood. And that is why there is a need for long-term protection. Long-term protection means you give the vaccine at the age of 1 year, and the protection has lasted for say 50 years. It means that during those 50 years, the child is not prone to get hepatitis A. And that is why after the age of 10, 12, 13 also, he won't have serious disease. Okay. Now remember that you have to understand the meaning of some terms like immunogenicity, efficacy, and effectiveness. In a society, Dr. Jog is staying, and he every day observes one boy and one girl looking at each other every day. And when they look at each other, there is seroconversion. Antibodies are produced. Nobody knows whether these two will marry or get engaged in future. Only seroconversion, immunogenicity. Okay. Then the parents come to know that there is some chemical locha going on. That is why they decide on 15th of June we will have the engagement ceremony under controlled clinical conditions. Dr. Zog is the HOD, very good children as subjects, and so many good professors and others in the clinical trial. So they compare the vaccine under controlled clinical conditions with other children who do not receive the vaccine. This is called as a comparable or a double-blind study. So the engagement takes place, and then 100% efficacy is proved in the controlled clinical trials. The girl says that I will live with you for 100 years. The boy says I will live with you for 100 years. Marriage occurs on 1st of August, and the girl comes home, and the blood pressure of the father-in-law starts rising. The fights between mother-in-law and the daughter-in-law, they start. Effectiveness, real world effectiveness, when the vaccine is brought into the market. So immunogenicity, efficacy, and effectiveness are to be understood in that particular sense. Okay. So IAP recommended that at the end of 1 year, give the first dose of hepatitis A vaccine. After 18 months, give the second dose. Okay. And then there is another vaccine which is called as a live vaccine, which is to be given as a single dose at 12 months of age. Okay. Now, some IT sector patients, they keep asking me whether it is compulsory. I tell them in life, nothing is compulsory. Even marriage is not compulsory. It is recommended. That is why IAP has recommended this vaccine. Okay, you have to decide. If you eat anything outside, have dirty water, and eat pani puri which is contaminated, God will not save you. Vaccine also will not save you. So remember that. In 1995, the first licensed hepatitis A vaccine by GSK came, and there are two important things which the purple book on page number 275 has mentioned. One, within 19 days of the first dose, there is seroconversion which starts. That means it's a fast seroconversion. I told you about the epidemic in Kerala. So as soon as the epidemic is detected, start vaccinating children in that area. Within 19 days, the children will start getting the antibodies. This is very important. This is fast seroconversion. Okay. With the live vaccine, this seroconversion takes 30 days. So it is not very much suitable for the control of epidemics. This is important. And then the long-term antibody persistence with this particular hepatitis A vaccine is for 50 years after the modeling studies. So the adolescence and even the adulthood is covered by this particular vaccine. This is a comparison of different hepatitis A vaccines available in the market, and the same thing I have written, that the one from GSK, that is Havrix, has 90% seropositivity up to 40 years, and with modeling studies it is extended up to 50 years, while the others are not having that much of a long-term protection. Along with the fact about this long-term persistence, the live vaccine has a 9% primary failure rate. That means after the 2 doses are given, 9% children do not develop these antibodies. Now one question, if the second dose, which is to be given at 18 months, is given earlier, before 6 months of completion of 6 months, what to do? The second dose is to be repeated 6 months after the wrong dose. That means suppose if you give the first dose today and the second dose after 4 months, then the second dose is wrongly given after 4 months. So from that wrong dose, you have to give the second dose 6 months after that dose. Remember this. And why this long-term protection is important, I told you, because hepatitis A in adolescence is dangerous. Okay. And conditions where you must give, one is of course chronic liver disease, because there hepatitis A will be dangerous, like Wilson's. Hepatitis B or C carriers, they already have a disease, so you have to protect them against hepatitis A. Immunocompromised patients, and then travelers to the endemic areas. So if someone like your relative comes from US to India, you know, he has to be protected by hepatitis A vaccine, otherwise he will come here as a white and go back as yellow. So that should not happen. Remember that. And then inactivated vaccines can be used in different people, particularly as I told you, immunocompromised. A lady before she gets pregnant, it is preferable to protect her against hepatitis A, because hepatitis A or hepatitis E are very, very dangerous in pregnancy. I will tell you another experience. 1992, there was an epidemic of hepatitis E in a place in Maharashtra called Karad. Okay, and I stayed there for 7 days and investigated all the epidemic. There was a common source of contaminated water. Remember, hepatitis E stands for epidemic, and that is why you have to be very careful. It's a disease which is very dangerous in adolescents and pregnant women. Of course, there is a vaccine which is under trial, but not yet in the market. Remember that. Of course, the incidence of hepatitis A is more under the age of 10 years. Hepatitis E is at a little older age. Okay, and I told you about outbreaks. Outbreaks, you have to give a vaccine which has a fast seroconversion. So with this Havrix, it is within 19 days that the seroconversion occurs, and that's why you can give it. Why I told you? Because I told you the question asked by my Khadus examiner, what is the incubation period of hepatitis A? 28 days. But the protection after giving vaccine starts within 14 days. That is why, because the incubation period is long, you can always expect that the vaccine starts protection within a short time. Okay. And post-exposure prophylaxis. One child in the house has hepatitis A. You know that the incubation period is 28 days, so the other child can very well be protected. So this is one of the vaccines which can be used as a post-exposure prophylaxis. That means the other child is exposed to the one in the family. Okay, and remember, the post-exposure prophylaxis has to be given within 2 weeks of exposure. Remember, so it's a precious birthday gift on the first birthday. Okay, and remember the various things starting from P. So it's a profoundly efficacious vaccine against picornavirus, pre-qualified by WHO, preservative-free, and gives persistent protection. So let us give our new generation long-term protection against hepatitis A. Thank you.